Hi, everybody. John Marshall from Georgetown and the Rouge Center for the Cure of GI Cancers. And I'm joined today by my two co-authors and good friends who we together just put together a very rapid publication with the assistance of the journal Colorectal Cancer to really try and set some ideas, some standards, if you will, some guidelines forward about how to manage our colorectal cancer patients through the COVID-19 pandemic. And so without further ado, let me introduce Dr. Ronit Yarden, and she's the Senior Director of Medical Affairs for Colorectal Cancer Alliance, and Dr. Ben Weinberg, who is my partner and good friend at the Rouge Center at Georgetown Lombardi. And Ronit, let me start with you and kind of talk a little bit about, on the ground, when this all started to come forward, what was sort of the reaction from patients? What were you all hearing on your helplines and the like?
Right, thanks. So the Colorectal Cancer Alliance is a patient advocacy group that its mission is to support colorectal cancer patients, raise awareness for colorectal cancer, and support funding of research. We have a patient navigation system and a helpline and a lot of programs to support patients. Our reach is about over 300,000 people a year. Yeah. And we have multiple social media outlets in which we interact with our patients and as well as other programs. Immediately as the COVID-19 pandemic started to be pronounced in the US and medical centers stopped closing their doors for non-emergency treatments. We saw a surge in patients reaching out to our helpline and navigation. They are stressed about their treatments, about their projective outcomes, what to do, what is safe, what is not safe. We actually constructed a webpage with updated information constantly with the help of our Medical and Scientific Advisory Board, and also linking to the CDC and other reliable websites, and to provide as much information as we can. And really big need of what is the right thing to do for the patients. And
yeah, so clear anxiety from on your end, your phones are ringing off the hook. And I think that was on some level true with us too, Ben. I mean, you know, when you talk about reliable websites, you know, these things are changing day by day in terms of what our recommendations are. And Ben, maybe you could set the stage a little bit about, you know, why we're even worried. You know, is a cancer patient more at risk? What's our current thinking? And what are some of the big picture things that we're doing to reduce that risk?
Yeah, and I think the central tenet of our review paper is really that, you know, cancer care is not elective, and we can't just put a pause on care for patients because there's a pandemic. And the other competing issue is we don't know how long this is going to last. Say, well, let's try this again in 2 months or 3 months. We have no idea, and we don't want to do something that, you know, makes us feel better in the short term in terms of minimizing risk to patients, but then we have bad outcomes in the long term, where patients who we could have cured are no longer cured because we compromised care during the pandemic. So what we've been stressing is that for patients with curable disease who undergo a curable surgery for colorectal cancer, and it's recommended that they get things like adjuvant chemotherapy or chemotherapy after surgery to improve their chance of cure, those are things we don't want to compromise on, and those are things that we have to continue, but may have to modify a little bit in ways to make them safer. For patients with more advanced disease, we're doing things to socially distance, but again, without compromising their care. So that's more virtual visits like we're doing now. It's spacing out trips to the infusion center, switching from IV drugs to pills. Those are things that we can do safely without compromising efficacy. And that's really our main goal here, is to not kind of throw in the towel and say, well, it's too risky for you to come to the hospital, to come to the clinic. There is risk, there is a real risk there, but we don't want to compromise potentially beneficial treatments at the expense of risk.
Yeah, and so I do think we're considering hospital exposure a risk in and of itself, just because that's where people are gathering. some of whom are sick. And many of the cancer symptoms are also chemo side effects are the same as sort of the COVID side effects and symptoms. And so we're trying to minimize that. But as you say, we can't just turn it off. In fact, I was thinking about watching our numbers at Georgetown, and we're running about 80–90% volume. Our surgeons are still operating. Our radiation suites are still open for business. And I actually think that's a very important message to go back to our patients, is that we are open and we are maintaining. Cancer is not elective, just as you wisely say, and we're maintaining treatment as best we can. So avoid clinic exposure. Ronit, have you gotten a sense yet about televisits and are patients saying that that's okay and they're relatively positive about it? Our feedback has been good.
Yeah, we hear the same thing, that patients are feeling okay about telehealth. There is still some anxiety that they don't have their physical as usual. And when they come in and there is a telehealth with the caregiver, that's a good system too.
Yeah. Yeah, I was thinking, one of the things that's very important to the Colorectal Cancer Alliance is the concept of screening. This, of course, happened in March, or started in March, which is our big awareness month for getting out there and go get screened. And we've been on our side, reducing the importance of screening, I guess, right now in the risk benefit. Ben, what's your take on that? If somebody was due and in the springtime to have their colonoscopy or whatever, is that something you push off, or is that something you go ahead and get done?
Yeah, it's a very good question. And I think patients who are asymptomatic, do not have any, high risk factors or things that, make them really need to get a colonoscopy now. If it's just a routine surveillance screening colonoscopy, I think that can be delayed. I guess the question is for how long. Yeah. I know our endoscopists are concerned. I'm not sure how aerosolizing their procedures are, but anytime you're injecting air like they do during a colonoscopy, there's risk of making more air particles aerosolized in a patient that happens to have COVID. That's not only risky for the patient, but risky for the team of docs doing the procedure. So I know those types of procedures are being really minimized because of that aerosolization risk. That said, if someone is having symptoms, weight loss, bleeding, abdominal pain, constipation, they need to be worked up. And it's not an elective thing to say like, oh, well, it's a colonoscopy, so that's elective, so you can do that in a few months. No, those patients still need the workup and evaluation. What we're talking about is patients who, have no history of colon cancer and are just due for their routine surveillance screening colonoscopy.
Yeah. So I think really sort of to wrap this up is, I think one thing we need to reiterate, we're open for business. We're trying to prioritize and balance risk and benefit, right? So we want to maintain treatments that have positive impact for patients. We want to minimize risk to individual patients. And we're doing this on a case-by-case basis. So if patients are out there concerned, just contact your team. My guess is every cancer care center out there is open for business and providing care. Any last thoughts for patients, Ronit, Dr. Arden?
Yes, I think, call your doctor, make sure that, that you are following their instructions, make sure that you're staying safe. And if you do have symptoms, if you do have, reach out to your doctor. Maybe you need to be seen and don't delay.
Yeah. Ben, any last thoughts?
I think the one thing where we're not 100% open for business is clinical trials. So a lot of patients come to us for trials. It's not necessarily that we're 100% closed in that regard, but we're definitely ramping those down in part, again, to minimize risk of exposure to patients and staff, especially patients who have to travel from far away. We're definitely put a hold on that for the time. We hope to unleash that, as soon as possible.
Yeah, you make that point. That's a really good one, is that we have been sort of patient-centric here, but we also have to protect our staff. And so every patient encounter on some level is a minor risk for us. And we're trying to reduce those as well because we're no good to anybody if we get sick. So thank you guys very much for this review, and we will hope everybody reads our paper and gets better insight into how to best manage colorectal cancer during the COVID pandemic.